I'm gonna take this not with my professional hat on at all, because as a professional, I should have known better, is kind of the narrative that I have with myself. But I will say, when my daughter had her grand mal seizure, it was 4 a.m. And she just hit the floor, and I slept on her floor for probably 2 weeks. And I'm not proud of it. And I feel a little like, gosh, Pam, you should have known better. But I was so terrified that she was gonna have another seizure. And I've been licensed for 20 years, and I didn't recognize in myself the symptoms of acute stress until it was, a month later. And I still, when we travel and we're changing time zones, I'm like, oh my gosh, we gotta get your sleep, we gotta get your meds. It's very hard as a parent. The ironic thing is, my husband and I were traumatized for sure, probably carried a diagnosis of acute stress for a period of time. But my daughter was fine. She's like, what are you guys talking about? It's all good. All I remember is waking up in the ER. And I'm like, oh my God, no idea. So that was the real struggle for us, is balancing, what we witnessed as parents and her own experience, her lived experience of like, you guys are tripping, like that's cool, And so I think, though I know that also for some patients with epilepsy, they also themselves, it's not just something that impacts parents and caregivers and loved ones, it can also impact the person living with epilepsy. And, the common symptoms of acute stress or PTSD include things like, and I will tell you, I had all of these, re-experiencing the event. So you're laying in bed at night and you see your child or your loved one having a seizure, even though they're not, right? It's very vivid in your own mind. Nightmares, awakenings, avoidance. So that was really, I didn't realize for me how big the issue of avoidance was, because I was trying to avoid every possible scenario that would set her up for another seizure. So, oh my gosh, we're staying out till midnight. Where's your meds? We gotta get these in. So those are the really common things to look out for with acute stress or PTSD, and it is real and it takes time. That's the thing. People are like, can you give me a pill for PTSD? Nope. You gotta do the work, you gotta give it time, and you've gotta process it in a safe environment.
I think noticing when my clients aren't doing the things that they want to do, that they know they wanna be doing these things, and just low mood or fatigue or worry just gets in the way, and they're noticing I'm not living the life that I really want to be. And even with really young kids, they're able to recognize that. And then what couples with that too is this feeling like, is this going to be forever? Like, have I reached this place in my life and now this is just how I am or how it's going to be? And no, like that's not true. When you're diagnosed, if you do get diagnosed with a depression disorder or an anxiety disorder, it is for a moment in time. It is a chapter. It is not lifelong. And there's so many things we can do to help people live the life they want to reach those goals that they want to. And so I think like those two things, knowing it's not forever, this isn't going to be who you are, and then really recognizing when your own mind is stopping you from living the life that you want.
We want to, as you suggested, we want to protect our loved ones from them, our loved ones from being embarrassed or having an awkward situation publicly. But in those instances, people really do start to fear having an event in public. And that dovetails really nicely into the ways in which our lives get more narrow. So if someone is in my office and they're talking about things that they appreciate or they enjoy, but they can't get themselves out to do any longer, or they have some kind of fear-driven decision-making, those are red flags for me as a therapist.
I wanted to be a professional. So that keeps me, like, it took me a while to realize, okay, this is happening, this is going to be part of my life. So I have to have this mindset. So I switch it and it's like, no, it's going to be a moment. I have this, I'm feeling, but with the treatment, with the medication of my neurologist, that helped me like, okay, I'm not having seizures anymore, so I can continue studying. And I went to school. I was able to drive to go to school to San Jose and come back. So I was able to keep that motivation in me. And studied for my exam, and it took me like 2 years to pass my board exam, but I did it, and that's what, and kept me motivated. So the support with my family, it was so helpful too.